Hello and welcome to this brief masterclass on traditional wisdom of a slow postpartum. So welcome to this class. I'm Naomi. I'm a traditional medicine doctor, registered Chinese medicine doctor, acupuncturist and registered nurse. And I welcome you to this very brief introduction to the philosophy that underpins my work with working with mothers and seeing that mothers and babies thrive through the experience of from preconception, pregnancy, birth, and postpartum. So I always love this quote from Vilma McClure, who wrote a beautiful book about the nature of motherhood. And one of the quotes that she has in referencing balancing, she says, when people are in harmony with natural laws, everything is in balance. The excess is reduced, the deficient is expanded, everyone's needs are met, and life is full of joy. And this is a really nice kind of philosophy to consider when we do start working with mothers and families, is what is happening in the foundations that might be resulting in life where everyone's needs are not being met and life is not full of joy. Some of that is inevitable in modern parenting, and some of it is preventable. And so the work here that I do and with the team at the Health Lodge really does kind of, the central focus is around how do we meet the basic needs, the fundamental, especially health needs of mothers, to ensure that the foundations are really strong for that motherhood journey, because it's really the baby's wellness is so dependent on the mother's wellness. So today I'll just be introducing you to a little bit of the philosophy around the culture of mother care. We'll be touching on traditional philosophies in postpartum care, what are the pillars that underpin that philosophy, and a couple of insights and top tips from myself about things that you might want to start thinking about if you are watching this and you are currently pregnant and planning your postpartum. So again, introducing myself, I'm a traditional medicine doctor and I have formal training in traditional Japanese, Chinese, Tibetan and Ayurvedic medicine. And I have 20 years experience as a registered nurse, also practicing folk women's medicine as a preconception, pregnancy, birth and postpartum, pregnancy loss and stillbirth doula, which basically means that I help hold the entire journey from preconception to 1 or 2 years postpartum. Everything that happens in between that, I attempt to meet with traditional medicine philosophy and healing to optimize health and well-being. And that includes pregnancy loss as well. So if we briefly start by looking at what are the intercultural pillars of postpartum healing. So when we look at many cultures of traditional cultures around the world in different continents, they actually have very, very similar and familiar postpartum cultural principles that are seen in the way that mothers are treated after giving birth. And it includes foods that are eaten, practices that are performed either physically or emotionally to support the mother's healing, so on and so forth. So these core foundational principles and practices are these 5 pillars. So they're very, very common throughout all of the world, and it includes rest, warmth, nourishment, ritual, and recognition. And recognition is also another way of basically being acknowledged by your village or your community for what you're doing and what has happened. And in traditional Chinese medicine philosophy, there's a few specific things in addition to these 5 principles. The first is the founding philosophy of Yang Shen. So Yang Shen literally is translated as nourishing life. So it's the principle, the founding principle of all of Chinese medicine is how to encourage the best and most vital life that you can live, where life is basically nourishing itself. And that is the principle that is sought to be practiced on a daily basis. And Yang Shen is really, really, really evident and respected in the childbearing continuum, because when it's that time of preconception, pregnancy, birth, postpartum is honoured and supported, actually that principle of Yang Shen will go up. The mother's health will improve, baby's health and overall needs being met during that time goes up. So you're improving and increasing Yang Shen. Unfortunately, in our modern, very busy, distracted culture, sometimes and unfortunately often, mothers and babies' needs aren't being met during this time. We're just kind of surviving. So Yang Shen goes down during that period of time, and then we try and make up for it later. We also have these concepts that postpartum is within a cycle that's specific to women. So it was acknowledged that how women were looked after in postpartum would determine her individual health and well-being for her entire life thereafter, and in particularly up until menopause. So a lot of care was taken to nourish and support women during their childbearing years of life. And in particular, the practice, and some people have heard of the 40 days, they might have heard it as 40 days, but it's actually referencing a cultural practice called Zhao Yuzi, which is translated as sitting the moon, which is a period of rest. And then these 5 pillars are also brought into that period of time where it's rest, and mother will stay at home. She won't be out and about with other expectations on her. And, you know, special foods and drinks are offered during that time, and healing body practices and treatments. And this is all in attending the physiology of the golden opportunity. So the golden opportunity is seen as the period of time around 4 to 6 weeks post the birth of a baby, where mothers' bodies are really, really suggestible to health and healing when offered enough nutrition and support during that time, that her body will actually get stronger, and her hormonal profile and return to menstruation and fertility in the future will be enhanced if we provide concentrated care during that time. Modern medicine and science is now catching up to this and has actually confirmed that in the immediate postpartum period, there is a much more pliable adaptability to the hormones of women, and we can leverage that time to optimize healing and prevent things like postpartum depression, postpartum depletion, healing of the pelvic floor, etc. So it's an exciting and emerging time in postpartum care, melding traditional and modern science. So the Zhao Yuzi that I was just speaking about is also referencing 4 specific stages of postpartum recovery and healing. And this is something I spend quite a bit of time educating women on, or sometimes I've even gone and done in-home postpartum care of the Zhao Yuzi practices to ensure that we have covered and optimized these 4 stages of postpartum. So it includes a first stage of eliminating toxins. They're not really toxins. It's really just talking about the accumulation of fluids and tissues in the pregnancy, that once the baby's born, they're no longer of use to the mother's body. So the mother's body has to eliminate these during the first days after birth. So we have tools and treatments to help facilitate this. We then have a repair and restore phase. Then we nourish yin and yang, qi and blood. And these are all predominantly consumed and generated in the pregnancy. And every pregnancy, we have to utilize these resources of the mothers. And we also rebuild the 5 elements and the Jing. So Jing is a unique concept to Chinese medicine that's referencing the sort of internal matrix that we inherit when we ourselves are babies, and it gives our capacity to have our own children. So some people have more Jing than others when they're born into the world, and there are practices that we can do to restore that Jing so that when we're moving forward for future conceptions and pregnancies, that aspect of fertility and reproductive health is optimized. So what are the benefits of providing this type of traditional mother care in postpartum? So there's a benefit at an intergenerational health level, meaning that the health and well-being, we've even found, is now directly related to the grandmother's health whilst the baby is in utero, because eggs in female babies are formed in utero, meaning that it's 3 generations directly related to intergenerational health. So every time we support a woman in pregnancy, we're directly affecting the future 3 generations. So the collective and community benefits from this practice. So it's well worth the investment. It's also, by doing these practices, it's part of acknowledging the work that mothers and women are doing in childbearing, which unfortunately culturally right now, we don't often see that women are being celebrated and supported in the childbearing role. It just seems to be something that we do in addition to everything else. It's not particularly celebrated or supported. So when we do these mother care practices, it helps women to feel valued and supported in that, which actually in and of itself reduces the risk of postpartum depression. We are reinforcing the wholeness of yang shen, so women are feeling better, feeling more vital, and you know, I suppose we work a lot clinically with women where that's definitely not how they're feeling, so we're reinstating that yang shen principle, sometimes 6 months, 12 months, 2 years, 5 years, even up to 7 years after the birth of a baby. So that sometimes doesn't happen in and of itself. It sometimes needs support and facilitation, and that's really the role of myself and other specialised clinicians at the Health Lodge, where our focus is restoring essentially the health and vitality of mothers. And this includes moving from into a place where it feels safe in those early days of mothering, because there's so much variability and up and down in those early days, that safety can sometimes not be the predominant feeling that women have, and it's more that they're feeling like they're surviving through the day. So that's a key point. If you feel like you're surviving your experience, there's probably more support that could be put in place so that you just at a minimum feel safe. If not, feeling, you are going to have times where you don't feel amazing, more than likely, but you should at least be feeling safe. So these investments result in benefits to the individual, but also everybody in the extended village reaps the benefit of that, because when mothers and babies are well, it means the community is really well. Because then mothers can give into the community rather than just dealing with the issues that are coming up for them as an individual, which takes them away from the collective. So what's the outcome? Where does postpartum end? So we're aiming for a deeply restored mother who's complete in her healing and becoming, resourced, connected, and confident in her intuition, with incredible physical health for now and when she meets her second spring, which is a saying referencing menopause. So that's really what an optimized postpartum outcome looks like. How we get there can look different to every woman. There'll be lots of different factors in each person's individual experience that will be impacting whether or not that's happening. And so our job is to find out why, if they're not at that place, why not, and what can be done to support that. And especially if there's nutritional depletion, it's very, very difficult to get to this place when you've got core nutrients that have been depleted throughout your reproductive years and in postpartum and breastfeeding. So one sort of aspect that I highly encourage women that I work with to look at that seems to really prevent some of those hardships is focusing on creating our village, because the modern village resembles nothing of our traditional village. In a times gone past, we would normally be born into an area where our mothers, aunties, extended family and relatives, people that we'd known our whole lives, all lived in the same area. So when a baby arrived, it was a community event. Everyone would help look after the mother. Now we're lucky if a husband has between 2 and 4 weeks of paternity leave, and often that's literally the only support that's put in place. And it's not entirely a winning strategy for what the actual physiological needs of a woman in postpartum are. So we're really under the baseline of what would be required to physically and emotionally restore after a birth. So some suggestions that I have are to start working in your pregnancy at who you might have a lot of friends, but are they available to actually come and see you? Do they know how to support you? Those kinds of questions, and starting to put that together, that you have significant support around you, both people scheduled to show up and help you, and also backup people in case something happens to those people. Also suggest if you don't have a strong available community, you can reach out to doulas and domestic workers to help fill that gap. After that, I would recommend finding a care provider, especially if you have medical issues or anything specific that needs support. You can come and work with our team or find local medical-based providers that are specialised in the care of mothers and understand what the needs are, so that they can help support you and create an experience that you really want to invest in, that you're feeling like that you're very safe and you're going to have access to what you need when you need it. Because sometimes you can feel quite overwhelmed and just not know where to go, but haven't really asked the questions prior to arriving into early parenting. What might I need? Who might I need around? So even something like lactation consultants and things like that, making those connections prior to the birth so that you've got people on hand if things do come up. So my top recommendations are having some reflective time and contemplation prior to the birth of your baby, to think about all these concepts, what matters to you, what you want to put in place, how much you've got to invest, if you need to restructure some things to make sure that you've got resources to invest in that time. And that I basically covered my next point: research and resource. So make the plan, then research and resource that plan and prioritize it. It's amazing how many people move house or open businesses and things during a pregnancy, and that can sometimes compete, or multiple other children. So just making and prioritizing that space and time. Develop and individualize your plan for this particular pregnancy. That can happen as well, multiple pregnancies. I just don't have time to plan anything for this postpartum. Something new comes up with mother or baby, and then all of a sudden we're managing a really different situation than the situations that they've perhaps had quite easy experiences in the past, and it can suddenly become quite challenging. Learning to communicate, asking for help, and also being able to set boundaries with people or activities or things that aren't helpful during that time, so that is really prioritized as a sacred time in your family, because you'll never really get that back. So only ever happens at the time of post-birth, that you can infuse all of this supportive care that will become the foundation of where you move forward from once you come out of early postpartum. And of course, food, sleep, and rest are the major priorities. So getting a really big fridge or freezer is always advised. So at the Health Lodge, we offer one-on-ones. I offer one-on-ones myself in treating women who are pregnant and planning their postpartum. They can also come and see me in their postpartum. We also have team postpartum planning with inter collaboration between myself, Dr. Oscar Serelak, functional medicine doctor, and Renee Dyson Holland, who's a specialised naturopath working in mother care. And we're really there to optimize the health and well-being of the mother, the baby, and the whole family. And sometimes I will be seeing all three of those people during the whole process, to ensure that everyone's optimally supported, which is such a joy. And you know, the best way that I love to work is preventing things from happening rather than trying to fix them once they have. So thank you so much for attending this brief little masterclass on, the founding principles of traditional slow postpartum. If you've got questions or you want to connect with myself or any of the team, you're welcome to reach out to the Health Lodge. We're located in Byron Bay in northern New South Wales. And if you are pregnant, I'm wishing you a very well pregnancy, a beautiful birth, and a supported postpartum. Thanks very much.